Hey everyone, it's Chris Burfield, and I've brought Christina Troha on this Skype call with me today. And the reason I brought Christina on is because we were talking, and she was informing me and educating me about durable medical equipment services and the supplies that they have. And she said, you know, Chris, we actually have a whole other side to DME. We have a wellness side to it. It's not just about, you know, taking TENS units and giving them the patients that are in acute pain. We actually have products that will help chiropractors get better correction, help their patients maintain their adjustments and hold their adjustments a lot longer, and speed up their healing process. So I wanted to bring her on today and just talk to us a little bit about those products that she has, and maybe have her show you a few of the items and explain to you how you can actually use these in your practice to enhance the correction that you're doing with your patients. So Christina, thanks for being on this Skype call today.
Sure, thanks for having me.
So tell us a little bit about the wellness side. You know, we were talking late last week, and you were informing me, you know, Chris, we've got this whole wellness side to DME. Can you share a little bit of what all you have that can help chiropractors with that side of their practice?
Absolutely. I think the first couple items that come to mind as being at the top of the list for the wellness part of it are the puncturing and cervical traction and back braces. So to start, I can show you, don't fall off my chair here. We have a lumbar posture pump where the patient just lays on this, and this would obviously be for their low back, and these are pockets in here that fill up with air when you pump them up.
Okay.
Okay? And then the same thing for the cervical posture pump. This just goes around the patient's chin and head, and you lay on it like this. So this air pocket right here fills up with air whenever you pump it up. And so these devices help to restore the natural curve of the spine in the cervical and lumbar area that might be missing. So these are great wellness products to help hold an adjustment after they're adjusted by the doctor.
Yeah, I agree with that. Great. You know, that's one of the things that chiropractors are shooting for, is they're aiming for getting that nice cervical curve or that nice lumbar curve restored back to their spine. And patients need to be doing home exercises. That's not just going to happen in the clinic. The adjustments are definitely going to, you know, reposition the bones and whatnot, but they need to be doing some form of posture pump or traction to maintain those curvatures.
Yeah, and they're really lightweight too. I mean, they're super light. I mean, this is just a couple ounces. Both of these are, and they just come in this little box. I mean, they're not really that big, so there's lots of good information on there. And then also I want to show you, we have this back brace. It's made by Aspen. We carry several different back braces, but this one by Aspen is definitely our most popular. So it is called a 637, and it has, I guess it helps take the plastic off so it actually sticks. But it has the spring back mechanism.
Oh, very cool.
So, I don't know how well you can see that, but it gets
No, we can see it. Yeah, it looks good.
But it gets very tight. And so the 637, it starts out with these side panels here, so it gives you additional support. And then these actually can just be pulled right off and removed.
Now, would that be something that a patient would wear, like if they were at a job where maybe they were doing a lot of heavy lifting during the day, or is this more of just for them to be sitting more upright in their vehicle, or like what is it?
Honestly, it's good for both. I mean, it helps to keep your posture where it's supposed to be, whether you're sitting at a desk all day, or it can just help to maintain your spine in the correct area when you are lifting heavy stuff at work. I mean, it really depends on the lifestyle of the patient, what they're doing, but regardless, it's going to help you just stay where you're supposed to be in regards to your spine.
And that piece that goes up in the back, yes, that piece right there, is that the piece that really kind of helps them maintain more of that correct posture while they're sitting at their desk or whatever they're doing?
Right, absolutely.
Okay.
And the fact that it has this string back mechanism on them with these little pull tabs, I mean, this really is what sets these braces apart. So you can only get the braces so tight when you pull, the big buckle part, like just the two big straps. You can only get them so tight. But when you actually use these thumb tabs and pull, there is like a shoelace design in the back here that zigzags all the way back, and it gets it so much tighter, and that's really what gives you like a really good support.
Okay, yeah, that's definitely different.
So that's awesome, and that's really lightweight and breathable material too, so people can either wear them under their shirt if they don't want it hanging out, or over their shirt too, whatever they prefer.
And is it fairly flexible where it gives them the ability, I mean, are they like locked in place, or are they able to like move?
I mean, this is pretty flexible, but you want it to be kind of sturdy so that it's giving you the support.
Okay.
So you can see though it's thin,
Yeah, I can definitely see that. Okay, cool.
Little show and tell here for you today.
Right.
And I just wanted to show you real quick too, because we just started offering these a few months ago, but this is the aquatherapy unit. It looks like a little cooler, but all you do with this is you just fill it up with water, and it's just a constant circulation of hot or cold water depending upon what your preference is, obviously by the doctor. So it has a hose that comes out, okay?
Okay.
And so that's where the water is going to be flowing, and then you hook it on to any kind of pad you get. Like this one, for example, is a boot that goes on your foot, okay?
Oh, okay.
And they have attachments on them. So you can get, a pad for your shoulder, for your arm, whatever area of the body. But it's great because it's a constant flow of either hot or cold water. Whereas if you're using a hot pack or cold pack, obviously it's only, but this is that constant flow, so they're really nice too.
Say that again. We broke up just a little bit. What about the cold and hot pack?
It's really nice. This is a better device than just a regular hot or cold pack because those won't always stay hot or cold for so long. Whereas this is a constant flow of the water through there, so it'll stay hot for longer or stay cold for longer.
Gotcha. So it's more of a constant. Yeah. And plus, they recommend that like you only keep ice on for about 15 minutes. And because anything over 15 minutes, you actually start to damage and burn the skin. And some patients don't obviously pay attention to that. They put the ice pack on and they're like, but it feels so good, and they don't want to take it off. And they leave it on there for 30, 45 minutes. And obviously that can cause some damage. But something like that, you have this constant flow of cold. You don't have to worry about, getting a cold burn. What do they call Frostbite? You don't have to worry about like frostbite or anything like that. So, very cool. So, are these pretty much all the wellness products that you offer?
Yeah. We do have a cervical traction as well, but I did not have one downstairs. So it's pretty much the same thing as the cervical posture pump. It just separates you a little bit more versus, curving it. It's a little bit bigger than the cervical posture pump, but it still has the same pumping mechanism. And it sits against your shoulders and then against your head here and just kind of pushes you this way.
Oh, okay.
Versus tilting you that way.
So is it something that like sits on the patient's shoulders, or do they lay down on the ground to use it, or?
You still lay down,
okay.
And it rests on your shoulders, and then rests on like the back of your neck here and your head, and just kind of, like I said, pushes you apart.
Okay, so it is like some cervical. So that would be good for even patients that are experiencing like bulging discs and stuff like that. If you get some of that separation in there and decompress that area. Okay.
Right.
Awesome. So obviously, you've got this whole other side of the practice. You obviously offer TENS units and ultrasounds and all that good stuff as well. But if a doctor wanted to start off, and one of the reasons I wanted to talk about this is because I know how beneficial DME products can be to a patient's recovery, to their overall wellness and their health. And I think sometimes a lot of chiropractors think it's all about just treating pain. So, some of those chiropractors are like, and I had one this past week, was like, I just don't want my patients to feel like the TENS unit got them better. And I talked to Dr. Sebastian Lipinski. I had a phone call with him yesterday. He actually gave a great testimonial for you. I'll be posting it later this week. Yeah. But he was saying that, he lets his patients know straight up, like, hey, this TENS unit that I'm giving you is not going to fix anything. Like, all it's going to do is provide you some temporary relief so that you don't have to use pain medications. Because his biggest thing is, I don't want them taking drugs. Drugs have side effects. This thing doesn't. So he lets them know, though, it's not going to fix your problem. Only the chiropractic adjustment is going to do that. But I wanted to help get you some relief in the meantime. So obviously, you have products that you offer on that side as well. But if a doc is really concerned about that, he can still use your company and use these wellness products. Get his patients a posture pump, a lumbar pump, some water therapy unit, a cervical traction unit, the back brace. I mean, those are all things that are going to help, keep posture maintained, help restore curves, and help maintain overall health. So thanks for showing us that stuff today. I really appreciate it. So if a chiropractor wants to get in touch with you and order some wellness products for his patients, what's the process in that? What does he have to do to contact you, and what kind of information does he need to get you?
You can always give us a call at the office, 412-249-8493. Or you can check out our website at www.troluna.com, and we have a 3-patient challenge on there, and you literally hit the button, put a little bit of your information in, and we'll send you some information on how to get started. And it's a great way to just, take us for a test drive. Send over 3 patients that would benefit from any type of DME that you see fit, and we'll get you started just to see how we work out.
Awesome. Well, fantastic. Well, thanks again, Christina. I appreciate all your help. And in the meantime, everyone, keep saving lives.